This is Pet Life Radio. Let's talk pets.
And we are live. We are welcome. You're here live with Dr. Jeff Werber, host for the next 30 minutes here on Pet Life Radio and Instagram Live. Here for you, here for your pets. Any questions you have, now is the time to ask. Hope everybody had a great week. I don't know why, it was a really, really busy week for me, like crazy busy. So, that's a good thing. Good morning. I'm waving to everybody. So, anyway, you know how to get a hold of me? Hello there, Steph. Yes, I was saying it was a crazy week. If you have questions, now is the easy time to ask. You can always reach me here. If you're here on Instagram, then all you have to do is just start typing away. And if you're on Pet Life Radio, if you're listening to this, you're probably here already. Good, stop. You can always reach me by phone if you like. 877-385-8882. Once again, 877-385-8882. And just want to hear and just talk about anything you want to talk about. As I said, a crazy week. I don't know what it was, but I know I feel badly, really, because I have a lot of people that come in, and unfortunately, I have this disease called I can't say no disease. So when people call, they have to come in, or they walk in the door. I get a lot of walk-ins. My rule of thumb is if someone's already in the office, I am not going to send them away. Now, they may have to wait. We'll do walk-in. Sometimes I can do what's called a drop-off. We'll convince them to drop the pet off. We'll take a look at them in between my appointments or just before I get into surgery, and they can pick up later. But no one's ever walked in the door and I said, sorry, we can't see you today. That has never happened to me in my 40 years. And I don't expect it to happen in my next, whatever it is left. So any questions you may have, now's the time. So a few things I want to talk about. Number one is, I was going to talk about this last week. Look, I love when we get sidetracked. I love when people come up with things and we can sit and talk for quite a while. So that's great. And hello, Deb, how you doing? But I was talking about emergencies. What constitutes an emergency? And, so many things that when something's off, and I'll give you some of the common ones. Blood in the stool. Oh my God. Okay. Vomiting. That's a biggie. And right away, for someone who sees blood in the stool, even blood in the urine, it's a freak out. So of course, they call their hospital. And if it's the weekend or in the evening, it's an emergency, a message goes out saying, hi, thanks for calling. We're closed. Go to emergency. So what do? Of course, you get in the car and you go to emergency. Let me tell you something I've learned over the years, just from our AirVet, our telemedicine platform, that 95, maybe even higher % of emergencies aren't. And having someone to talk to, having someone to help with what we call the triage, going through a case, deciding really what's going on. And when it's on video, it's even better. I've gotten some, cases about a vomiting dog. And we do FaceTime on the app. And this dog is running around, can't wait for its next meal, drink water, running over with the ball or the frisbee to play. I don't care that there was blood in that vomit, or they vomited in the first place, because this dog is not sick. So I'm going to ask the basic questions. What did he get into? What really was the issue? And we're going to get to that in my next thing. I'm going to talk to you about a really, really big case I just had. Important for dogs to have vitamins. I missed I could only meat. Okay. So here is my thought. Hey, B, how you doing? Here's my thought about vitamins. So I take vitamins. I take supplements. I take an NAD+. I take CoQ10. I take glucosamine, chondroitin, MSM, and a multi. Now, I feel great. And I don't know how much of this is because of the things I do. Is it because I try to eat well? Because I try to stay on the lean side instead of the heavy side? But I feel really good. And I look at, other people my age, I'm at 70, and I'm thinking, what are they doing wrong? Or what am I doing right? Or guess what? It could be just genes. I mean, my sister's on here. She doesn't look her age. So my brother, I just saw him 2 weeks ago. He doesn't look his age. We're all, between my oldest sister and me, 5 years apart combined. Me and my oldest sister, 2 years. My little sister, 2 years. My little sister and my little brother, they're 1 year apart. My mom had 4 kids in 5 years. Wow. By the time she was 25, she had 4 kids. So it's kind of crazy. My feeling is this. Are they going to hurt? Is there something going to hurt? No. Now, most foods on the market, especially those that are what we call AAFCO certified, that if you look at a label, they all should say that our ingredients or our formulas meet or exceed those standards as established by AAFCO. Okay? So that's the Association of American Feed Control Officials. If the food is AAFCO certified, it should be balanced enough. Now, Would it hurt to give a multi? Or if you're giving less commercial diets and you're making your own, you're adding your own foods, then give a multi. Absolutely. That's not going to be a downside. The only time you can get too much, we know there are water-soluble and fat-soluble vitamins. The water-solubles are the B's and the C's. Fat are A, D, E, and K. And so, yes, could you overdose on vitamin A and cause a problem? Yes. Vitamin D, yes. But it would be really, really difficult. So if you want to give some supplements at home, that's probably fine. Now, as far as the other things that we are hearing a lot about, for example, for older dogs, the NAD, for older dogs also that might have arthritis or joint problems due to the glucosamine and chondroitin, my feeling is you can't overdo it. It'd be really hard to overdo it. Just do a basic amount, follow the instructions on the label, and I think it's okay to give supplements. So that's my take on that. I know I missed another question. Friend's dog with very soft stool for about 5 days. They put them on half scrambled eggs and rice. We got to talk about that. Otherwise, normal. That stuff is burned down and eaten fire. Oh, yeah. Okay. So here's my thought. By the way, that's a great question because so many times when it comes to diarrhea, everybody run to rice. Well, it turns out there's intestinal diarrhea that could be small intestinal and then large intestinal, large bowel, small bowel diarrhea. Now, I find, and this is how I learned, and it's still working for me, that when you have small intestinal diarrhea, for example, parvovirus, animals coming back from parvo, it knocked the crap out of the intestine. And yes, we were putting them on cottage cheese and rice or chicken and rice, and I still use rice. But most of the diarrheas, by the way, small intestinal diarrhea is usually associated with a dog that doesn't feel good. So they're not eating well, they're lethargic, they maybe tender abdomen. So they're off. And that's one way I can tell whether it's small bowel or large bowel diarrhea. Dogs with large intestinal diarrhea, or we also call that colitis, inflammation of the colon, they can have mucus in the stool. They can even have blood in the stool, and they can have mushy, kind of soft serve kind of diarrhea. Don't get that image in your mind, by the way. But I want to stick to this soft serve and not think about, my dog has that. So anyway, these are the ones that the dog is still acting fine, is running, can't wait for its next meal. There's a big difference. So those, I don't like rice. For those, I want added fiber. It's like you think of it as counterintuitive. Wait, but you take fiber because you want to soften the stool. Yeah, but so if you give too much fiber, then yes, the soft stool will continue. But if you give just enough, it's enough fiber, it sort of coats the ingesta as it's passing through the colon. The colon's job is to resorb the last amount of fluid, but it can't if it's all inflamed. So the whole idea is you want to reduce and decrease the inflammation in the colon so it can start doing what it's supposed to do. Then the bleeding and the mucus you see, that's because the lining of the colon is being dragged off. It's like scraping off. So therefore, that's why you're seeing red blood. Now, the difference, if there's bleeding in a small intestine or in the stomach, by the time it comes out, then we have what's called melena or melena, depending on potato. And that is the bleeding that by the time it gets out the other end, it's sort of like digested, it turns black. That's black, tarry stool. When there's frank blood or red blood, that's coming from the colon. It looks bad, but it's not as bad. So I don't worry about it. If you see melena or melena, then you're looking at some stomach, you can gastric ulceration, you can have problem, you can have a growth, some sort of tumor in the small intestine, you can have really severe intestinal disease in the small intestine that causes bleeding, then that's more serious. But the red blood that you might see from a colitis, it looks bad, but it's not as serious. And the mucus on top of that, so then you're dealing with large intestinal diarrhea. So talk to your veterinarian. There's also, I use often, in addition, sometimes if it's just a colitis inflammation from something that was eaten or ingested, right, then it oftentimes gets better within 4 to 5 days on its own. But I like to add a little fiber. And if it's really bad, I'll put them on some flagyl, metronidazole, which is a great antibiotic for large bowel diarrhea. But you got to be careful with that too, because too much flagyl is not good. I'll usually give it once for a 7 to 10 day course. I may repeat it once, but after that, you got to take a break. So anyway, then if it's about 5 days, back to this case, the scrambled egg is fine, but instead of rice, use either psyllium powder or canned pumpkin or cooked oatmeal or cooked sweet potato, cooked yams, just added digestible, edible fibers that will probably help soothe the colon as it's going through, and then it'll have a chance to heal. All right. Boy, that was a mouthful. So thank you. Thank you so much. Look great. I feel great. A lot of waving. Let me wave. The worker, when your tech vet gave us the psyllium to add on the food when Riley got the runs. Yes. Yeah, it worked. And the psyllium is great, by the way. In fact, I was at a talk in January at the VMX, and it was a GI talk. I obviously I like to go see things because, first of all, you never can stop learning. Secondly, I like to go to talks that either interest me a lot. So I do a lot of behavior. I do a lot of Francie Boas talks. That's the brachiocephalic obstructive airway disease talks or syndrome talks. Then I do, obviously, skin, GI, I like, and ophthalmology. I love eye stuff. Could kidney levels read poorly on a cat if they're not feeling well, or is it automatically kidney disease, 8-year-old male? Well, it depends. If it is the BUN that's high, but the normal creatinine, the normal phosphorus, then I'm thinking it could be dehydration status. It could be something that was eaten because the BUN, so BUN, blood urea nitrogen, when that's elevated by itself, but creat and the phosphorus are normal, then I'm thinking it could be other. Now, if you have the kidney values where the BUN is high and the creatinine is high, it still could be what we call pre-renal, depending on how high. If it's very high, most likely it is renal disease. If it's just minimally high, it could be what we call pre-renal azotemia. Azotemia are those levels that are elevated, and that could be because of other things like dehydration status, like something diet, like something that was minimally, I hate to use the word toxic, but irritative, and it elevated those kidney enzymes. So it's not for sure that it's bad. Now, if it's a cat, an 8-year-old, and we know that 8-year-old cats are, they're starting to get a little older. We know that kidney disease is the number one killer of older cats. Could it be the early signs? And the answer is, of course. So what I would do is if the cat's doing well, eating well, I would start on a kidney diet, and there are a number of good ones out there. Of course, a full panel. 8 years of age, I would have done a full panel anyway. So a full panel to make sure everything else is fine and monitor the cat. Cat continues to do well, is eating well, is urinating, and he's on a renal diet. I would recheck in about maybe 4 to 6 to 8 weeks and see if things are coming down. Okay, I hope that helps. Last night, just stop the rice and add pumpkin. Yes, good idea on that. Creatinine is the issue. Okay, so if it is high creatinine, I am more concerned, absolutely. And I think, again, kidney diet, following up, plenty of fluids. Either make sure the cat's drinking well, or you might even have your veterinarian show you, or your technician, a veterinary nurse, show you how to give subcutaneous fluids at home, because that's very important also. Because if we see the increased fluids helping bring those values down, then that's a good sign. All right, bladder stones. Lab showed my dog has structural bladder. I think that would be struvite. And my dog, I've been feeding him single protein of allergies. Should I change his diet? Well, oh my God. The answer is yes. And this brings me to the other things I wanted to talk about today. I've had 3 cystotomies, 2 in a dog, 1 in a cat, in the last 2 or 3 weeks. And the first one, I have to say this, it's funny. I get follow-up like this, and it just justifies what I do and why I do it and why I'm having so much fun. And I really get such satisfaction out of doing it. So, dog named Santo, blocked twice. We were able to reduce the blockage. We were to unblock the dog. It's a dog. And you can see x-rays, clearly some stones. They're kind of small, some of them more, but one was getting lodged in the urethra. And we're hoping that maybe a kidney diet could help. So we unblocked the dog, and sure enough, within 2 days, he's back again. All right, it's a surgical disease. We go in, do surgery, because he was blocked and his bladder was, first of all, extended. It was so irritated. It was bloody. It was terrible. I hate doing bladder surgeries on dogs like that. We're in such bad shape. Anyway, but we had to. So we go in, we do the surgery, we unblock him. I got stones out of there. It was crazy. So the bladder up, I do a double close on the bladder wall itself. And then we close the abdomen, close the skin. And so this morning, he did great. Took the stitches out. He was doing great. So it's been about 3 weeks now. And I turned my phone this morning, and there is a video of his name was Santo running around the backyard. And I got this, which is and I wrote back, so cute. And she writes, "You kept Santo alive. I'm indebted and grateful." And when I get things like that, it just makes my day. Those are the cases. Now, look, I would always say this, and again, no ego here, that probably most of our cases get well in spite of us. I say this to veterinarians, not because of us. In other words, all we do is give that a little extra hand, give that support. Oh, the body's amazing. The body's going to take care of itself. But every now and again, we get these cases where I can actually say, these hands actually save this pet's life. And when that happens, it's the best feeling ever. And I really know that this is the profession I chose. And And I don't know, it was calling and why you do it. Anyway, another story going back to the eating all that crap, all right? And we call it pica. And I have another story for you. And we're going to do it when we come back, so don't go away. It's a good one. We'll see you back here after these short messages from our sponsors and Pet Life Radio. Take it away, Mark.
Oh, sure. It's all fun and games until someone ends up in a cone. That's right. We are animals. Deal with it. Pet Life Radio. Let's talk pets.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Okay, we're back here live on Pet Life Radio as well as Instagram. And so I want to talk about pica. Pica is the eating of inanimate objects. Dogs that get into garbage. Like, it's one thing when a dog gets into garbage and eats food or leftovers or bone. It's one thing when they eat like everything. So one of my friends actually brings up a good point about psyllium, which I love, by the way. I like eating pure psyllium husk powder because, as it's written here, and she's right, that some of the ones you find in your pantry might contain artificial sweeteners. We know about xylitol. So read the ingredients. If you're going to use psyllium powder, which I love, you want to use pure, unadulterated psyllium husk powder. All right. Anyway, back to pica. So one of my friend's dog comes in, and I've known this friend forever. And I also have known his dogs forever. And this dog is a 9-year-old doodle and the sweetest dog, but has been losing weight, eating well, no vomiting. And this is the key, no vomiting. And he's truly what we call ADR, ain't doing right. So, of course, I do x-rays and a blood test. Blood and urine came back totally fine. So now I'm really scratching my head. What is going on? And I see something in his stomach. It was like maybe the size of a large meatball or an egg in the corner of the stomach. And I'm thinking, why? Is this a mass? And he's not vomiting? No, he's not vomiting. God, it's really weird. So we follow up a couple of days and he's still there eating. He's still eating. And not vomiting, this is the mind blow. So I have my friend, Dr. Sam Trivedi, who's a board certified internist, who's a master of ultrasound. And I do abdominal ultrasounds, but more cursory. I have to look for big things. But when it comes to looking at the thickness of an intestinal wall or the lining of a wall, etc., then I want Sam to come in and do it. So he does, and he confirms that by now, by the way, this mass is twice as large. And the density is such that some parts are thick, some parts are thin, with confidence. He has never led me astray. He says, this is not a mess. This is ingested. This is something in the stomach that needs to come out. So, okay, on his recommendation, we set up for a surgery to do what's called a gastrotomy, and then we'll also run the bowel. And so we open the dog up and pull the stomach out. We do what's packed the stomach. We don't want anything leaking back into the abdomen, even though after bladder surgery, after any kind of intestinal surgery, we flush the bowel, flush and suck out this and flush. And we want to make sure we do a good job, because there's an expression that dilution, all right, is the answer when you have pollution. So if there's anything in there that could be causing severe abdominal problems, all right, then we want to make sure we flush it out. So flushing and flushing to dilute it out is the answer to polluting. So let me tell you what stuff we pulled out. First of all, paper, plastic, plenty of grass and weeds, a label from like a shirt or something. How about a receipt from some market? I mean, this dog has such terrible pica. And I think when it started feeling badly, it's like a lot of dogs run out and eat grass. I guess his answer was to go out and eat everything. So it was unbelievable. I have a bag. I took a picture of it, of everything we pulled out of his stomach. It was unreal. The good news is that after we removed everything, checked the stomach, closed him up, closed the stomach. I close stomachs like I do the bladder in 2 layers. And then we ran the belly. That means we went through the entire intestine all the way to to what we call the ileocecal junction, which leads to the colon. Usually if something's in the colon, you leave it alone, it's going to come out. Anyway, and that was clean. So post-op, the dog's doing great. We sampled some of the intestines, and but it's amazing. When you have a dog, and here's the take-home lesson. If you have one such dog that cannot keep his mouth away, especially on walks, you need to get yourselves a really good basket muzzle. This is a muzzle. It's not a muzzle like you have an aggressive dog that you're going to worry about getting bitten. A basket muzzle, they can drink. All right. They can breathe. They can pant. It's like a big basket that fits right over the muzzle, and you attach it behind the neck. And this way, they can smell things, they can drink water, but they can't eat things. They can't get it through the little slits in the basket. And that's what you need to do, because I don't know if a dog like this could even withstand another surgery like this. This was a major surgery on an older, fairly good-sized dog. So it's really, really important to, when you get a chance, when you have these dogs, you want to go ahead and you want to get a basket muzzle. Do not let it happen twice. Another example of this, I just mentioned earlier that I had to do a surgery on one of my cats. One of the 3 cystotomies I did was a cat. But I didn't mention, I'm going to mention now, that the cat had the same surgery a year ago. A year ago, March. Now it's April of the next year, and he's got another need for cystotomy. This is a lot for a cat to take, for any animal to take. So, of course, after the first one, we evaluated the stones, and it came back struvite and oxalate, which are the most common. So we mentioned there are a couple of diets that you should put this cat on that will help prevent the formation of new stones. Came back in July, and so follow up, UA, etc. I asked her, so by the way, how's the cat doing on the diet? And she goes, we haven't started that diet yet. I'm thinking to myself, are you crazy? You got to start this diet. Sure enough, this cat was back in April and a second surgery. And believe me, after a surgery like this, these animals get, a lot of called adhesions. So the anatomy is not exactly the same as it was. Now you're trying to get to the surface of the bladder where you want to open, and you have to remove tissue and to sort of dissect it away to be able to get access to where you really want to make your incision in the bladder. And with all these adhesions, it's kind of tough to do. So anyway, listen to your veterinarian. Larry, how you doing? By the way, I have one of our visitors with me today, my friend, Dr. Larry, and he actually we did surgery on his brother's dog, a little Sheltie. And here, now Larry's a doctor, he's a physician, he's an OBGYN, but does something really specialized. But he asked if he could scrub in with me and help me with surgery. And he did. I think it's the first time I ever had an MD scrub in with me to help me with one of my surgeries. And it was great because they are really well trained, I got to tell you. So it was great. And the dog's doing amazing, which is even better. So anyway, prevention is the key. We always say the best way to treat a condition is to prevent it. So when you have these animals and they've already shown to you that they have certain behaviors, stop them before they really start causing a problem. And that's the best solution. All right, what else do I want to talk about? So we talk about the emergencies. So just talk to somebody. If look, our platform we think is the best, but any platform where you can have access to a veterinarian, and there are a number of them out there, before you rush to emergency, get that second opinion. It's got to be a live video chat. A picture's worth 1,000 words. A live video is worth 100,000 words. And I've had so many cases where I've made a decision just based on a video chat. And I'm 99% times right. But with most of these platforms, they always give you an option to follow up in a day or two. So you can always change things if the animal's not getting better. I think that is pretty much it. Let's see if there are any other questions that people have. Chihuahua mix is 14 years old. His eyes are starting to get cloudy. What should I do to prevent the eyes to get worse? Well, first of all, a wonderful question. What we see when these eyes get cloudy. Now, again, it should be seen by your veterinarian just to make sure. But typically, what it is called lenticular or nuclear sclerosis. That is a scarring of the lens capsule. Now, when the problem is in the lens itself, that's usually a cataract, and it gets all murky. If this is more of a haze, it's more uniform, whereas cataracts can have blotchy areas, and it usually doesn't affect vision. At least they can see a lot. They still have PLR, pupillary light reflex. They still can see. Sometimes in lower light, it starts maybe getting blurred. But technically, it is a pre-cataractous condition. Why? It's involving a lens. But in order for this, just the sclerosis, to cause blindness, the dog would probably have to live to about 20 or 30. Obviously, it's not going to happen in most cases, and on probably any case. So as it progresses, and it may cause some vision impairment, but it usually doesn't cause blindness in most cases. So what can you do about it? Nada, nothing. There's some drops out there that claim, I have not spoken to a veterinary ophthalmologist yet who's confirmed that there's anything that we can do about it, because it's just part of the aging process, and it happens. And again, just don't worry about it. But again, I would have your eyes checked. Your doctor, your veterinarian can do what's called the ocular fundic exam, looking through the lens the back of the eye, checking the optic disc, checking the vessels, checking the retina itself, looking for retinal separation, other things that can cause the diseased eye. If all that is normal, and it's just basically lenticular sclerosis, and as I said, very, very common. We see it in a lot of dogs. I think we're good. I think I got everybody down here, and I want to make sure I did not omit any great questions or hellos. I appreciate all the visitors. So, okay, if there's nothing else, we'll run a minute over. I know that our good buddy here, Mark, who runs our Pet Life Radio, real quickly, my Yorkie Poo Ming will be 7 tomorrow. Any tips on keeping him healthy? Happy birthday, Ming. Yes, just like people, exercise, good diet, okay? Keep them mentally acute, mentally sharp. So always, playing with them. There are some puzzles. There are things you can do for a dog to keep their mind as active as their bodies. And that is the best thing you can do. And understand that, well, first of all, for Yorkie Poo, 7 is not, I consider small breeds getting to be seniors at 8. That's when I would say, as a routine, doing annual blood and urine tests, just to keep an eye on them. For a large breed, it's 7. And this is assuming everything else is fine. So that's it. Keep them lean, because I tell you, it really parallels people. That obesity is the number one nutritional disease affecting pets. And when they are obese, what happens? They can't do as much. So when they can't do as much, what happens? They gain more weight. The more weight they gain, the less they do, the more they gain. So we have to be very, very, very aggressive with their diet. They're feeding them, modifying foods, modifying amounts based on their activity levels. And this is really what needs to be done. So keep an eye on that. And also, again, nutritional supplements, if they work, that's great. As they get older, I love leap years as one, but there are so many things. Talk to your veterinarian that could help. My thoughts on the food Fresh Pet. These are really good foods, just food for dogs, Fresh Pet. Are they the best? Well, there's no such thing as the best. We've talked about that ad nauseum. But are they good? Yes. They're balanced. Yes. So if they like it, they're costly. So if you don't mind the higher price and your dog doesn't have any particular specific disease or condition that might limit their ability to have this food, then go for it. Most importantly, as we know, we've talked about this before. Number 1, they have to like it. Number 2, they have to have nice, firm stools. Number 3, lots of energy, a nice, shiny coat. So if all of those are happening with the Fresh Pet and you don't mind getting it, or have they said to you, however it's said, then obviously stick with it. If it ain't broke, don't fix it. So don't change foods just because someone else says, oh God, my dog does great on Fresh Pet. If your dog is doing great on what he or she's eating, then don't change. And if you want to change for whatever reason, then it's important to do it gradually, because you can go from great food A to great food B. And if you do it properly, they're always going to have some GI upset, whether it's a little vomiting, a little diarrhea, mostly diarrhea. And you're going to say to yourself, oh God, I switched that food and got diarrhea. It's not good. No, it may be fine, but you want to make your adjustments. It's got to be a slow transition from food A to food B over about a 7-day period. A little bit each day, you're decreasing the food A, and while you increase the food B until you're on 100% food B. If that doesn't work, he doesn't do well, once he's on it 100%, then it may not be the right food for him, but it could be the right food for somebody else. All right? Anyway, there you have it. Thanks for joining me here on Pet Life Radio and Ask the Vets with Dr. Jeff. And I don't know if I'm the best, but I would like to think I'm one of the better. How's that? How's that for being right in the middle there? So anyway, we'll see you next week. During the week, if you have anything you want to talk about, please reach out to me. I get great subject matter to talk because of you. So if there's something that's going on with your pet, trust me, if it's going on with your pet and it's a concern, I guarantee it's happening to some other pets as well. And please, by the way, if you have friends that are not following me and want to learn some new things and better take care of their pets, then I'm very easy on Instagram, Werbs_DVM. And that way they're going to notice every Sunday morning at our show, and they can hop on the show and ask questions. All right? Very, very good. And Mayor, I see it hopping on the middle. Karen, hi, how are you? All right. So, it's a Mayor's birthday also. Wish happy birthday to Mayor. That's important. All right. All good. We'll see you guys next week. Same bat time, same bat channel here on Instagram Live, and Ask the Vets with Dr. Jeff here on Pet Life Radio. Have a good week.
Let's Talk Pets every week on demand, only on PetLifeRadio.com.